एक मिनट हाँ started. Hello, we are on. Namaskar. I need some feedback from those who are participating. How is it possible for me to find out? You guys can send me a chat. Those who are logged in. So first of all, Namaskar. I'm Dr. Vipul Roy Rathod. I'm the Director of Gastroenterology at the Fortis Hospital, Mulund, Mumbai. I welcome you all in this session. I was requested to say a few things on the gut health. Now, we have to also understand that people who take care of their bowel or their gut, they usually enjoy a good physical and psychological health. What are the key ingredients of gut health? So, first of all, majority of Namaskar Vijayji online, majority of people who suffer from digestive diseases or disorders, they have to reflect on basically three, four things. Number one, lifestyle. Now, when we say lifestyle, what does it comprise of? Lifestyle comprises of what, how you lead your day. That is, or I'm talking of the solar cycle of life, right from the sunrise to sunset. What are your activities? How you manage your meals, within the meal what you eat. You also, part of the lifestyle is how hectic is your commute or travel. Is it very stressful? Like tobacco, alcohol, if there are any other habits. Lifestyle also means whether you have adequate sleep, also means whether you have adequate yoga, meditation, exercise in your life. So there are so many variables in a lifestyle. And this is one of the main contributing factor, or I would say multiple of them or all of them are probably contributing, leading to poor digestive health. There are external influences apart from this lifestyle, which could be infected food or infected fluids or liquids which you intake, which can have infection in your digestive system and can lead to uh, digestive discomfort or disorder or upset stomach. People will have diarrhea, people will have a vomiting sensation, nausea, fever. All these things are possible because of a viral or a bacterial infection in the food or drinks which they have taken. Unhealthy lifestyle or unhygienic lifestyle, I would say, or unhygienic food. So we can't possibly talk in the given specific period of time of 15 minutes as to what are the key factors leads to a good digestive health. So I'm going to summarize in basic three, four things which you need to take care, which are directly under your control. So number one, try to follow a solar cycle. So when I say solar cycle means you wake up in the morning as the sun comes up, and most of your work duties should be over by the time of sunset. Ideally speaking, before you retire to bed and your last meal, you should have a gap of 3 to 4 hours. What does that mean? If you are sleeping at 9:30, 10, ideally you should finish your meal before 7 o'clock. So if you stick to this kind of a solar cycle with a food habit, especially your dinner before 7, then vast majority patients will not have symptoms of reflux. People in urban centers, they say we have heartburn, they have reflux, acid reflux in the night, because the reason is people are eating very late in the night and then they watch TV for an hour or so, or they are on their cell phones, or they are on the computer, or whatever they are doing, and then they retire to bed. So this is a short invitation to gastroesophageal reflux disease. So people will have to take care of that and avoid uh, lying down or sleeping within an hour or two of the meals. So therefore, this is a very important thing which you can do. That is, try to follow a solar cycle of work and your food habits. Now, when it comes to food, a sincere request to most of the viewers today is to avoid raw and uncooked food outside your house, because you do not know the level of cleanliness, the level of hygiene of that food prepared. We do not know. Anything which is cooked, which has boiled, is reasonably safe to eat compared to uncooked meals or salads or chutneys or sandwiches. I think if you avoid these things, then you can probably maintain a good gut health. Balanced diet, and when I say balanced diet, means our diet should constitute fair amount of protein per day, lipids, fats, and also carbohydrates in a smaller quantity. And you have to have a lot of colorful green leafy vegetables and fruits. So if you ask me how do we split our diet, I say ideally we should have, ideally, it's not possible, but 50-50 means 50% of your plate should consist of uncooked raw food like vegetables, salads, fruits, or whatever. Or in a whole day, that 50% of your diet should constitute raw vegetables and fruits, not juices, fruits. Because when you have fruits, you also have fiber along with it, and it helps you to fight constipation. It helps you to fight absorption of bad, lipids, fats, and all those things. So fiber is important, and therefore I encourage having people having fruits rather than juices. Some people can have vegetable juice. If some of the vegetables are not possibly eaten raw, then you can have vegetable juice with adding of lime or ginger, or and some of the avla and some of the fruit, small fruit, which gets a little flavor. So yes, you can do that, but at home under strict hygienic condition. So whenever you consume any raw food, you make sure that the level of hygiene is adequate. That includes your home, because sometimes I have seen from very good families, patients develop digestive infection purely because nobody has really bothered to service their water filters, or the house help is probably not having good hygiene protocols in preparing food or cleaning utensils. So many factors can influence your digestive health. So uncooked food outside house, if you avoid, eat on time, the last meal, adequate sleep. When I say adequate sleep, anywhere between 6 to 7 hours of sleep is adequate. Medium, moderate use of spices, oils is always healthy. There is a lot of debate about whether to have ghee or not, but it is my personal experience out of so many other patients who have tried it, that if you take cow's ghee, it actually works like medicine for you. A lot of people have this misconception that ghee adds to cholesterol, bad cholesterol, and it will lead to hypertriglyceridemia and all those things. Well, there are various theories for and against. But through my experience of last 25 years, I think people who are moving away from cow's ghee probably should start eating cow's ghee. So, a small personal, I don't have enough data to back my statement, but this is a personal experience which I'm sharing with you, which allows you to have proper greasing in the system and which is a good fat, cow's ghee. Also, you need certain level of lipids for some of the metabolic process in your body, some of the enzyme chains. You need some of the lipids also. So, complete fat free diet is not suggested or advised, please. So, have a balanced diet, adequate sleep, and most important, pranayam, yoga, meditation, and exercise. Why I advocate for this? Because I have experienced this in my own life. It helps. I remember if I'm eating at home by and large, I do not have any GI upset for many, many decades now. The moment I eat something unusual, even if it is a cooked food, you can feel the difference. And this is what I mean. So, we do not know the quality of ingredients used in restaurants or food outlets. We do not know the quality of oils they use, spices they use, how fresh are the vegetables, we do not know. So there are so many challenges outside food can pose you. And therefore, I personally, how often do I go and eat outside? Very rare. So these are some of the basic lifestyle related modification which you can make which will impact your gut health. Pranayam, yoga, meditation, and exercise. I don't think anybody has a choice. If you want to avoid doctors, if you want to avoid medicines, and you want to avoid any major health hazards, I think these few things are very, very important. Unfortunately, in our society, more prosperous you grow, more people become less mobile and they are more on their mobiles. Okay. So I think this we need to change, more of physical activity, some form of physical activity daily, not thrice a week. No, daily. A regular bowel habits, passing stools regularly, is equally important because that helps you clear out all the waste products which your body has already processed. Bowel constipation can also lead to serious psychological constipation. Your thought process will get affected. And I'm sure all of you must have used this term or heard about this term that this is my gut feeling. Now, what is this gut feeling? Gut and mind are in constant dialogue. They are talking. Give you an example. If somebody gets bad news in the family, one or two members of the family may need to rush to the toilet or because of nervousness or because of bad news. What is this? This is a direct impact of your mind thought process on your bowel. So, people, those who are getting constipated, they should immediately address the issue because a constipation can become a very serious chronic problem. When I talk of health, gut health, we are talking essentially of, I will answer that question, or intermittent fasting is good or not. I'll answer that question. Somebody asked. When you are talking of gut health, we are essentially talking of two aspects of health. One is physiological health. And when you talk of physiology, we are talking of digestive tract, which consists of food pipe, stomach, small intestine, and large intestine, liver, gallbladder biliary system, pancreas, spleen. Okay. Now, these are the main digestive organs we have in our system, which contribute to our overall gut health. That is called the physiological aspect of gut health. Then there is a psychological aspect of gut health, that you are constantly lack of sleep, constantly disturbed, constantly you are worrying, you are anxious, there are anxiety attacks. That will have a havoc on your digestive tract. Believe me. And therefore, people have started developing something called irritable bowel syndrome. The diagnosis itself is a syndrome, irritable bowel syndrome. Well, there are some scientific explanation according to our research of medical literature. We have certain Rome classification, Rome 3, Rome 4. All this classification will have a lot of scientific inputs. But again, irritable bowel syndrome essentially means that your gut is irritated. And what are the reasons which can lead to irritation of the bowel? Your mind can be one of the main reason, apart from some of the food habits, lifestyle, as I mentioned. So, psychological health, physiological health will ultimately decide your gut health. Okay, so that is there. Somebody asked me whether intermittent fasting is good. Now, what do you mean by intermittent fasting? Usually, we eat our meal, say the last meal, if you decide to eat by 7 o'clock in the evening, it is perfectly all right if you don't take anything throughout till you sleep, or in the morning till around say 9, 9:30, 10. This itself is an intermittent fasting. You can straight have a breakfast at 9, 9:30, whatever. It is perfectly healthy. I myself practice this, so I can share you that. And it can help. Essentially, what you are allowing is that your body also need a little break from constant ingestion. Your system also needs some breathing space to process whatever you've eaten. And that also kicks in the metabolism. So I feel that intermediate fasting is useful for many reasons. One of the reason is that those who are really wishing to lose weight, it can help them. Because I have seen some patients, or many patients, who have done that and have benefited. I would appreciate if there are any other questions. Refrain from alcohol is possible. I think alcoholism is a disease. Please understand, if somebody in your family is constantly craving for alcohol, it's a disease, and it has to be addressed like a disease. It's not a habit anymore. It starts with a habit, but it gets converted into a disease. So, alcoholism is a disease. Somebody asked me, can you refrain from taking alcohol? I think willingly, if you make conscious choice about life and health, yes, alcohol you can refrain from. We, as Indian, genetically, I don't think we are designed to drink alcohol. And that's a whole new subject and debate we can have. But genetically, Indians, I don't think, are designed to have large quantity of alcohol consumption. No, they will damage their livers very, very fast. Why hiccups become severe sometimes, what care needs to be taken. Now you have to understand what are hiccups. Hiccups are your diaphragmatic movements or irritation of diaphragm. Diaphragm is a sort of a curtain which separates your thoracic cavity from your abdominal cavity. So for some reason it gets irritated, it starts moving, and there are many reasons for that. I don't want to go into some of the pathologies which can lead to this kind of hiccups, but I'll tell you some of the dietary bad habits which can lead to hiccups. If somebody is in a lot of hurry and they eat food very fast and reasonably large volume, they can develop hiccups immediately. That's number one. Number two, if somebody who has chronic abdominal discomfort and is ignoring acidity like symptoms, or sometimes heartburn they are ignoring, these are the patients who will start developing continuous hiccups because of severe irritation of the lower end of the esophagus. And then there is direct, indirect stimulation of the diaphragm and can have a lot of hiccups. There are certain patients with chronic kidney issues, they can also develop hiccups. These are some of the common causes of hiccups, and the best remedy, if anybody wants to try, why I cannot tolerate spice, though moderate, while my other family members easily digest. You have to also understand. I spoke about hiccups, so that concludes a part of the hiccups. The best way to control hiccups, I'll tell you the technique. Take a very deep breath, and hold it for a while. Just hold it without any thoughts. Just hold it as long as you can. And then very slowly exhale. It may not stop in your first attempt, maybe subsequent 3, 4, 5 attempts, it will stop. Your hiccups will stop. Okay, to do that. That is one thing. You cannot tolerate moderate spices while your other family members easily digest them. Now you have to understand, even though you are genetically connected family members, that does not necessarily mean that your constitution is same. You are very different. Every human being is a very different individual, and therefore we all have different thumbprints. Why do you think? Billions of people, 8 billion people. So we are all having a very different constitution, though you share the genetic pool with your family. It does not make you same. No. You need to identify why you are not able to tolerate. Just being family is not enough. There is a reason behind it. So you need to find the reason why you are not able to tolerate spices. I'm sure you'll find the reason. The most important thing for any patient to see a specialist like me or gastroenterologist, any other gastroenterologist. If you have a digestive issue, you have taken medicine from your family doctor, your GP or physician, whoever. If you take it for 2 weeks and beyond 2 weeks, if the symptoms persist, you need to see a specialist. Okay. So I think I've answered the question of the person who asked. IBS with elderly patient, how to deal with it? Very challenging. I agree. Now you have to understand that irritable bowel syndrome at any age is a diagnosis of exclusion. What does this mean? That you have to exclude all other pathologies in the intestine or digestive system before you arrive to a diagnosis of irritable bowel syndrome. Okay. So, what does this mean? This means, especially in elderly people, Since you have asked me about IBS, I want to share with you. I have seen so many patients now. I must have seen almost quarter of a million patients in my career, and must have done more than 100,000 endoscopies in career so far, which is a reasonable experience. And what I've learned out of this 25, 30 years of my work is that don't blindly label patients with IBS, because we have identified patients who are diagnosed IBS outside all across Mumbai and India. When we started investigating them, we actually found some organic disease in them, which was contributing mainly for their symptoms. So, though the person who has asked me this question, especially in elderly, now when you talk of elderly, I won't say elderly, I would say anybody above the age of 45 is a cutoff line. If they have altered bowel habits, indigestion, they need to see a gastroenterologist. Please do not ignore this. Anybody, avoid ignoring your symptoms, because you have to understand that human body has tremendous intelligence. Anywhere we have a intelligence at a genetic level. The genes are so intelligent. The mitochondria, the cellular level intelligence is so high. Only problem is that we are unaware of it. We are even unaware of what our body is trying to tell us. So listen to your body. Okay. Coming to our next question, precautions to be taken to avoid hyperacidity. So, as I said, hyperacidity is a very layman expression. When you say hyperacidity means the so many symptoms can lead, which you can infer as hyperacidity, like post after eating you feel bloating, fullness, burning, heaviness, chest burning. All this you can have one term called hyperacidity. I've already told you about the lifestyle modification which you can do. So if you do, that should be the first step. Second step is you should take at least 1 or 2 weeks of antacid. Antacid for 2 weeks. You stop all the medicine and see how you feel. If there is any problem, then you need to see a specialist. Now, a specialist will guide you how to find acidity. Now, just now I did a procedure for a 17-year-old girl. She is suffering for last 3 months, going from pillar to post. She has already seen about 6 doctors, and she is constantly complaining of warm, hot upper abdominal feeling, heaviness after meals, nausea, and they've been trying to take medication for last. I saw her. I said, we would like to diagnose what is wrong with you. So we did her blood test, and her ultrasound is normal. So whenever you have a digestive issue, upper abdominal digestive issue, there are three most important investigation you should do. Number one is a blood test, which takes care of your digestive aspects like liver function test, your complete blood count, maybe your stool examination, urine examination is part of the workup. Vitamin B12 and D3 estimation, very important. Thyroid hormone estimation, very important. You do these basic things, do a sonography. The sonography will tell me about liver, about gallbladder, and about pancreas. Because all these three organs also can lead to acidity like symptoms. We call it dyspepsia. I will come to the question of Ushaji regarding leaky gut. Just allow me to finish this particular segment. So, when you want to diagnose, do blood tests, do sonography for the solid organs, and then any patient who is having recurrent bouts of acidity, not settling down with couple of weeks of therapy, you need to have endoscopic evaluation, high definition, high resolution endoscopy. People are not taking care of their symptom because they are not listening to their body. Now, doctor, please share some light on leaky gut. Okay. Now, leaky gut, uh, it's a very complex physiological, pathophysiological phenomenon, which I can't describe in very simple layman terms. But what I'll try to explain is by simplifying it. What happens is that when you eat food, the food starts digestion process starts from your mouth when it mixes with the saliva. When it goes in the stomach, is actually churned like a mixie, mixed and properly grinded, and then this part of whatever is mixed with acid and gastric juices will go down to the small intestine, where small intestine in turn will have its own intestinal secretions, pancreatic juice, bile comes from the gallbladder and the liver. This all concoction will go further down in the small bowel and it will process your food, break down into molecules, micromolecules for nutrients, micronutrients. Now, what happens is that for some reason, your gut becomes, when you say leaky gut, I'll come to this question of bowel movement. So, let me finish this one. When you talk of leaky gut, is there are barriers in your intestine which does not allow some of the pathogens to cross. Now, when does this barrier go down? When you have a recurrent infection or abuse of alcohol, when you have uncontrolled diabetes and other metabolic syndromes like thyroid issues, where the ingredients in the intestine stays longer than normal individuals because of a slow metabolism, and then they develop this so-called leaky gut. It is a very loose term, which I don't want to go into the semantics of it in terms of scientific language. I'm trying to make it as simple. So what I personally believe, that uncontrolled metabolic syndrome is a major contributor to leaky gut. Uncontrolled abuse of alcohol and tobacco also can contribute. Unhealthy lifestyle, food intake which is not hygienic, can also precipitate this. So these are some of the common causes which you need to take care. Any supplement can be taken for regular bowel movement. Yes. Now the most important, I won't say supplement, but we all need supplements beyond a certain age. Please understand that. And the reasons are manifold. The most important reason is today we do not have the purest form of vitamins, nutrients, and micronutrients in our food. It's gone. The reason is the quality of our topsoil of even India is depleting very fast. And therefore, the quality of ingredients in the food which we eat, especially fruits and vegetables, has gone down drastically. On top of it, spraying of pesticides, insecticides, genetically modified foods, and all this has led to a big question mark as far as the total nutritional value of the food. And therefore, I am of firm belief that beyond the age of say 40, 45, people should take on a regular basis some form of uh, supplement for vitamins, especially vitamin B12, especially vitamin D3 if people are not getting exposed to enough sunlight, and also vitamin B12 if those who are strict vegetarians. So yes, you can take those vitamins also, which can help you bowel movement, not only necessary isabgol. My question is, bland food is digestible, but after some time it comes up heaviness and bloating in morning sometimes. So obviously, it does not matter whether your food is bland or is with spices. If food is not being pushed down by the stomach into the intestine, obviously we need to find out what is the problem. So we need a proper investigation. After eating small portion, feeling bloating, heaviness, well, you need an expert advice. You need, as I say, three things: blood test, ultrasound, and high definition endoscopy. Don't just keep popping pills. Now, I want to tell you something, I think very important for the viewers today. When you take one tablet of anti-acid, that is Omaze or pantoprazole or omeprazole or whatever prozole, it reduces the acid suppression in your stomach by 90%. What does this mean? Suppose you are producing 1 liter of acid in your stomach for digestion every day, for your regular meal digestion. When you take one tablet, it pushes down your acid suppression to 90%. So, what does this mean? That you are producing only 100 ml of acid to digest your food, and you expect that in 100 ml of acid, your food will be broken down in microparticles or nutrients and micronutrients, and your intestine will absorb. It's a fantasy. It will never happen. And therefore, people are feeling tired, people are feeling lazy, people are not feeling energetic in the morning when they wake up because they keep popping this pill, which is completely destroying the digestive system. So please, for God's sake, do not take this anti-acid medication without proper supervision, please. The reason is, the day you take the medicine, your acid suppression is 90%. The next day when you don't take, it jumps. There is a rebound phenomenon in the stomach where is a spring action. The acid production will be 1.5 liters. So instead of 1 liter acid to be present in the stomach, next day you will have more than 1 liter, and that is damaging the lining of the stomach. And this is how the whole story starts. Okay. So do not take medication without proper diagnosis. That is the first rule you should follow, because all allopathic medication are essentially chemicals. Okay. Is there any superfoods by for improving gut health? Well, I think in G20, our honorable Prime Minister and the entire uh, committee of hosts, they fed millet-based diet. Now, millets were always known to India for centuries or millennia. We have moved away from millets. I think if you switch over from wheat to millets, half your digestive problems are over. Yes, I call them superfood. Yes, of course, there are some vegetables, there are some fruits which probably has earned a category of superfoods. I don't want to spell them, but yes, there are. If you eat even good quality bananas, I would say a banana is a superfood. Guava, do you know highest level of antioxidants are in guava? Most people don't know this. The cheapest fruit available in the street has the highest level of antioxidant. Yes. So we are not aware about our own dietary habits. We eat unconsciously. So it is my humble request to all the viewers today to eat consciously and responsibly for your gut health. With that, I conclude this session. If there are any queries, please share us on email queries, and we'll try and see whatever best we can. Or on the next live session, I'll try to address them. Namaskar.